Welcome to Nurse's Lab. Welcome to your exam preparation for BLS certification. In this series, we break down the essential skills you need to pass: high-quality CPR, rapid arrest recognition, effective ventilations, and confident AED use. Everything is simplified, structured, and exam-focused to help you master the latest AHA standards. For more AHA updates and certification-ready lessons, make sure you subscribe and stay connected. Question number 1. A nurse finds an adult collapsed in the ward corridor. The scene is safe. The patient is unresponsive, not breathing normally, and only gasping. What should the healthcare provider do next? A. Check the carotid pulse for 30 seconds before acting. B. Start CPR only after the crash cart arrives. C. Check pulse and breathing simultaneously for no more than 10 seconds. D. Give 2 rescue breaths first, then check pulse. Correct answer is C. Let's see the explanation. In the adult BLS algorithm for healthcare professionals, after checking responsiveness and activating help, the rescuer looks for no breathing or only gasping and checks the pulse simultaneously, with the pulse check limited to 10 seconds. If no definite pulse is felt, CPR should begin immediately. Question number 2. According to the 2025 AHA Adult BLS guidance, the recommended adult chest compression rate is A. 80 to 100 per minute, B. 90 to 110 per minute, C. 100 to 120 per minute, D. 120 to 140 per minute. Correct answer is C. Now let's see the explanation. The 2025 Adult BLS guideline states that rescuers should perform adult chest compressions at a rate of 100 to 120 per minute. Question number 3. What is the recommended adult chest compression depth during manual CPR? A. At least 1 inch, 2.5 centimeters. B. At least 2 inches, 5 centimeters, while avoiding excessive depth greater than 2.4 inches, 6 centimeters. C. Exactly 2.5 centimeters, 6.4 centimeters. D. At least 3 inches, 7.5 centimeters. Correct answer is B. So what about its explanation? The 2025 Adult BLS guidance recommends compressing to a depth of at least 2 inches, 5 centimeters for the average adult, while avoiding excessive depth greater than 2.4 inches, 6 centimeters. Question number 4. 2 providers are performing CPR on an adult without an advanced airway. Which approach is most appropriate? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. Continuous compressions with no breaths. D. 5 compressions to 1 breath. Correct answer is B. Let's see its explanation. For adults in cardiac arrest before placement of an advanced airway, the guideline supports 30 compressions followed by 2 breaths. Each breath is given over about 1 second. Question number 5. During a rhythm check, the AED advises a shock. After the shock is delivered, what should the team do next? A. Pause and check for a pulse immediately. B. Pause and recheck the rhythm immediately. C. Resume CPR immediately for 2 minutes until the AED defibrillator prompts rhythm reassessment. D. Give 2 rescue breaths, then reassess. Correct answer is C. Now let's see the explanation. The 2025 Adult BLS algorithm states that after a shock, rescuers should resume CPR immediately for 2 minutes until the AED defibrillator prompts rhythm reassessment. The guideline also says post-shock pauses should be as short as possible. Question number 6. An adult patient has a pulse but is apneic after suspected opioid overdose. Which action is most appropriate? A. Start chest compressions immediately. B. Provide 1 breath every 3 seconds. C. Provide 1 breath every 6 seconds, check pulse every 2 minutes, and administer naloxone if available. D. Wait for naloxone before providing breaths. Correct answer is C. Let's see the explanation for this answer. In the 2025 adult BLS algorithm, if an adult has abnormal breathing but a pulse is present, the provider gives 1 breath every 6 seconds, 10 breaths per minute, checks the pulse every 2 minutes, and for suspected opioid overdose, administers an opioid antagonist such as naloxone if available. Question number 7. When 2 or more rescuers are available during adult CPR, compressors should generally switch: A, every 30 seconds, B, every 1 minute, C, approximately every 2 minutes, D, only when visibly tired. Correct answer is C. So what about the explanation? The guideline says it is reasonable to switch chest compressors approximately every 2 minutes, or after about 5 cycles of 30 to 2 CPR to preserve CPR quality. Question number 8. A responsive adult suddenly clutches the neck, cannot speak, has a weak cough, and is becoming cyanotic. What is the recommended first treatment sequence for severe foreign body airway obstruction in 2025 AHA adult BLS? A, 5 abdominal thrusts only, B, 5 chest thrusts only, C, 5 back blows followed by 5 abdominal thrusts, D, start CPR immediately. Correct answer is C. Let's see its explanation. A major 2025 update is that for responsive adults with severe FBAO, rescuers should perform repeated cycles of 5 back blows or slaps, followed by 5 abdominal thrusts until the object is expelled or the person becomes unresponsive. Question number 9. A choking adult becomes unresponsive while you are helping. What should you do next? A, continue abdominal thrusts only. B, sweep the mouth blindly with a finger. C, start CPR beginning with compressions. D, give 2 breaths before compressions. Correct answer is C. Now let's see the explanation. In the adult FBAO algorithm, if the adult becomes unresponsive, the rescuer should start CPR beginning with compressions. Before giving breaths, check for a visible object in the mouth. Blind finger sweeps are not supported. Question number 10. Which statement best reflects a key systems and performance message from the 2025 AHA Adult BLS update? A, mechanical CPR devices should routinely replace manual CPR. B, early high-quality CPR and prompt defibrillation are the most important interventions associated with improved adult cardiac arrest outcomes. C, pulse checks during CPR should be frequent and prolonged. D, continuous chest compressions are always superior to 30 to 2. Correct answer is B. So, what about its explanation? The AHA highlights states that early high-quality CPR and prompt defibrillation are the most important interventions associated with improved adult cardiac arrest outcomes. Routine mechanical CPR is not recommended. Question number 11. A nurse sees a visitor suddenly collapse in the hospital lobby. The person is unresponsive and making occasional gasping sounds. A second rescuer is bringing an AED. What is the best immediate action? A, place the person in recovery position and monitor. B, check breathing for 30 seconds to confirm apnea. C, check pulse and breathing at the same time for no more than 10 seconds, then start CPR if no definite pulse is felt. Or D, deliver 2 rescue breaths first because gasping means respiratory arrest only. Correct answer is C. Now let's see its explanation. In adult BLS, gasping is treated as abnormal breathing. The healthcare provider checks pulse and breathing simultaneously for no more than 10 seconds. If there is no definite pulse, CPR begins immediately. Question number 12. A healthcare provider finds an unresponsive adult inpatient on the floor. No co-team is present yet. What is the correct priority as a lone responder? A, start 5 cycles of CPR before activating the emergency response system. B, activate the emergency response system first, then begin CPR immediately. C, give 2 minutes of rescue breathing before calling for help. Or D, Search for naloxone before assessing pulse. Correct answer is B. Now let's see its explanation. The 2025 Adult BLS guidance states that after identifying an adult in cardiac arrest, a lone responder should activate the emergency response system first, then immediately begin CPR. Question number 13. During a code, one rescuer is compressing very fast at about 135 per minute because faster is better. Another rescuer is compressing shallowly to reduce rib injury risk. Which correction is most appropriate? A. Compress at 80 to 90 per minute to reduce fatigue. B. Compress at 100 to 120 per minute and at least 2 inches, 5 centimeters, while avoiding excessive depth greater than 2.4 inches, 6 centimeters. C. Compress at 120 to 140 per minute with any depth that produces visible chest movement. Or D. Compress as hard and fast as possible without pausing. Correct answer is B. Now let's see its explanation. Adult BLS recommends a compression rate of 100 to 120 per minute and a depth of at least 2 inches, 5 centimeters, while avoiding excessive depth greater than 2.4 inches, 6 centimeters. Question number 14. An AED analyzes a rhythm, advises a shock, and the shock is delivered. One team member says, "Stop and check the pulse now." What should the team leader instruct? A. Check pulse immediately, because a shock may have restored circulation. B. Reanalyze rhythm immediately before resuming CPR. C. Resume CPR immediately for 2 minutes. D. Give 2 breaths and then reassess. Correct answer, C. So what about its explanation? After a shock, the adult BLS algorithm directs rescuers to resume CPR immediately for 2 minutes before the next rhythm analysis. Question number 15. A patient in the outpatient area is unresponsive after suspected opioid overdose. The patient has a definite pulse but is not breathing normally. Which action is most appropriate? A. Start chest compressions because the patient is unresponsive. B. Provide 1 breath every 6 seconds, recheck pulse about every 2 minutes, and administer naloxone if opioid overdose is suspected and it is available. C. Give naloxone only and wait for spontaneous breathing to return. Or D. Provide 1 breath every 3 seconds and do not reassess pulse. Correct answer is B. Now let's see its explanation. In the 2025 Adult BLS algorithm, if the patient has a pulse but is not breathing normally, provide 1 breath every 6 seconds, recheck pulse about every 2 minutes, and administer naloxone if opioid overdose is suspected and it is available. Question number 16. A responsive adult in the cafeteria cannot speak, has a weak cough, and is turning blue. Which intervention best matches the 2025 AHA Adult FBAO algorithm? A. Begin with abdominal thrusts only. B. Begin with chest thrusts only. C. Use repeated cycles of 5 back blows followed by 5 abdominal thrusts until the object is expelled or the adult becomes unresponsive. D. Start rescue breaths immediately. Correct answer? C. Let's see its explanation. A 2025 update for responsive adults with severe foreign body airway obstruction is repeated cycles of 5 back blows followed by 5 abdominal thrusts until the object is expelled or the adult becomes unresponsive. Question number 17. A 3-year-old child is found unresponsive in a backyard pool. After removing the child from the water, you find no breathing and no pulse. What is your first action? A. Deliver 2 rescue breaths before compressions. B. Begin compressions immediately. C. Apply the AED first. D. Perform abdominal thrusts. Correct answer, A. Let's see its explanation. In pediatric drowning, the priority is ventilation. Give 2 rescue breaths first, then begin CPR if no pulse is present. Question number 18. A choking adult becomes unresponsive while you are assisting. After lowering the patient to the floor, what should you do next? A. Perform abdominal thrusts until EMS arrives. B. Start CPR beginning with chest compressions. C. Sweep the mouth blindly before starting CPR. D. Deliver 2 breaths first to force the object out. Correct answer, B. Now let's see its explanation. If the choking adult becomes unresponsive, the algorithm says to start CPR and begin with compressions. Blind finger sweeps are not part of the adult FBAO algorithm. Question number 19. 2 rescuers are performing adult CPR without an advanced airway. One rescuer has been compressing for several minutes and is visibly tiring but says, "I can keep going." What is the best practice? A. Keep the same compressor unless compressions fully stop. B. Switch compressors approximately every 2 minutes to preserve CPR quality. C. Switch only after 10 minutes to avoid interruptions. D. Switch after every 30 compressions. Correct answer, B. Let's see its explanation. The AHA Adult BLS guidance says it is reasonable to switch compressors about every 2 minutes to maintain high-quality CPR. Question number 20. A patient arrests in a hallway outside radiology. The team wants to move the patient into a bed space before starting CPR because it will be more convenient. What is most appropriate? A. Move the patient first, then start CPR in a better location. B. Begin resuscitation where the patient is found as long as high-quality CPR can be delivered safely and effectively. C. Delay CPR until a monitor is attached. D. Wait for the full code team before beginning compressions. Correct answer, B. Let's see its explanation. The 2025 Adult BLS guidance states that adult cardiac arrest resuscitation should generally be conducted where the patient is found, provided high-quality CPR can be delivered safely and effectively. Question number 21. A hospitalized adult suddenly becomes unresponsive. The monitor shows an organized, narrow complex rhythm at 70 per minute. The patient is not breathing normally. You check for a pulse for 10 seconds and do not feel one. What is the best next action? A. Do not start CPR because the rhythm is organized. B. Start CPR and use the AED/defibrillator as soon as available. C. Give 2 rescue breaths only and recheck in 1 minute. D. Wait for a physician because this is not VF. Correct answer, B. Now let's see its explanation. An organized ECG rhythm does not guarantee perfusion. In BLS, if the patient is unresponsive, not breathing normally, and no definite pulse is felt within 10 seconds, you begin CPR immediately and use the AED/defibrillator as soon as available. This is a classic trap for pulseless electrical activity, which is not identified by "looks okay" on the monitor. Question number 22. A responder says the monitor looks like ventricular tachycardia, but let's check the rhythm longer before doing anything. The patient is unresponsive, apneic, and pulseless. What is the best response? A. Delay treatment until a 12-lead ECG is obtained. B. Begin CPR and apply the AED/defibrillator immediately. C. Give rescue breaths only because VT may still have a pulse. D. Wait to see if the rhythm self-converts. Correct answer, B. So what about the explanation? In adult BLS, an unresponsive patient with absent normal breathing and no pulse is treated as cardiac arrest. The correct action is immediate CPR and use of the AED/defibrillator as soon as possible. Early defibrillation is critical for VF/pulseless VT. Question number 23. An AED is attached to an adult in cardiac arrest. It announces shock advised. What should the team do next? A. Check pulse again before shocking. B. Deliver the shock, then resume CPR immediately for 2 minutes. C. Deliver the shock, then wait to see if the patient wakes up. D. Delay the shock and give rescue breaths first. Correct answer, B. Now let's see its explanation. When the AED advises a shock, deliver it, then resume CPR immediately for 2 minutes until prompted for the next rhythm check. Post-shock pulse checks and prolonged pauses are a common exam trap. Question number 24. A patient is unresponsive, not breathing normally, and pulseless. The AED says no shock advised. What is the best immediate action? A. Remove the AED because it is not needed. B. Start rescue breathing only. C. Resume CPR immediately for 2 minutes. D. Reanalyze the rhythm immediately. Correct answer, C. The explanation is, if the AED advises no shock, that means the rhythm is currently non-shockable from the AED's perspective. In BLS, the correct action is to resume CPR immediately for 2 minutes before the next analysis. Question number 25. A team member sees a nearly flat tracing and says, "This is asystole, so don't use the AED." The patient is unresponsive, pulseless, and apneic. What is the best BLS action? A. Accept the visual impression and skip the AED. B. Begin CPR and apply the AED/defibrillator as soon as available. C. Give naloxone first. D. Wait for the code team to interpret the rhythm. Correct answer, B. Let's see its explanation. BLS providers should not rely on a quick visual guess from the monitor alone. A nearly flat tracing may represent true asystole, lead problem, or fine VF. The BLS priority is CPR plus AED/defibrillator as soon as available, letting the device analyze whether the rhythm is shockable. Question number 26. An adult collapses. The monitor shows a chaotic rhythm. The patient has occasional gasps. A new nurse says, "He's still breathing, so do not start CPR." What is the best action? A. Place the patient in recovery position. B. Check pulse and breathing simultaneously for no more than 10 seconds. If no definite pulse, start CPR at once and use AED or defibrillator as soon as possible. C. Give oxygen only because gasping counts as breathing. D. Wait for gasping to stop before acting. Correct answer, B. So, what about its explanation? Gasping is not normal breathing. In adult BLS, you assess pulse and breathing together for no more than 10 seconds. If there is no definite pulse, begin CPR at once and use the AED or defibrillator as soon as possible. Question number 27. During CPR, the patient briefly has a few abnormal limb movements, but the monitor still shows a chaotic rhythm. A rescuer wants to stop CPR to say, "Watch what happens." What is best? A. Stop CPR because any movement means ROSC. B. Continue BLS sequence and only pause when prompted for rhythm or pulse assessment. C. Give abdominal thrusts. Or D. Remove the AED pads and reassess later. Correct answer, B. Let's see its explanation. Brief movement alone does not confirm ROSC. In BLS, compression should continue with minimal interruptions, and pauses should occur only when needed for the AED or defibrillator prompt or rhythm or pulse assessment. Question number 28. A patient is found unresponsive after a suspected opioid overdose. The monitor shows a slow, organized rhythm. The patient has a definite pulse but is not breathing normally. What is the best BLS action? A. Start chest compressions because the patient is unresponsive. B. Provide one breath every 6 seconds, check pulse about every 2 minutes, and give naloxone if available. C. Ignore breathing because the rhythm is organized. D. Shock immediately because any unresponsive opioid patient needs defibrillation. Correct answer is B. Now let's see its explanation. If a pulse is present but breathing is absent or abnormal, BLS calls for one breath every 6 seconds, pulse reassessment about every 2 minutes, and naloxone when opioid overdose is suspected and available. Question number 29. During adult CPR, the monitor operator asks for a long pause to make the rhythm strip look clearer. What is the best response? A. Pause as long as needed to classify the rhythm exactly. B. Minimize interruptions and resume compressions as soon as possible. C. Stop CPR until the ECG tracing improves. D. Skip compressions and focus on ventilation. Correct answer, B. Let's see its explanation. The 2025 AHA approach continues to emphasize high-quality CPR with minimal interruptions. Even when ECG information is available, BLS care should not be delayed by prolonged rhythm viewing. Question number 30. A conscious adult suddenly becomes pale and diaphoretic. The bedside monitor shows a very fast, wide, complex rhythm. A rescuer says, "Any scary rhythm means start chest compressions now." What is the best BLS response? A. Start CPR immediately because the rhythm is wide and fast. B. First assess responsiveness, breathing, and whether a pulse is present. C. Shock immediately without checking the patient. D. Give naloxone because the patient looks unstable. Correct answer, B. So what about its explanation? BLS treatment is driven by the patient, not by monitor appearance alone. If the person is conscious or has a pulse, CPR is not started. The first step is to assess responsiveness, breathing, and pulse. Question number 31. A patient collapses just outside the radiology suite. The floor is clear, the scene is safe, and the code team is arriving. One team member says, "Let's move the patient to a bed before we start anything." What is the best action? A. Move the patient first, then begin CPR in a better location. B. Start CPR where the patient is found, as long as high-quality CPR can be done safely and effectively. C. Wait for the full code team to position the patient. D. Delay CPR until a backboard is placed under the patient. Correct answer, B. Now let's see its explanation. The 2025 AHA Adult BLS Guidance says resuscitation should be generally conducted where the patient is found, as long as high-quality CPR can be provided safely and effectively. Moving first is a common in-hospital delay trap. Question number 32. An adult inpatient is found unresponsive. One nurse is at the bedside, one is calling the code, and another is bringing the defibrillator. What should the bedside rescuer do while the others activate the system and get equipment? A. Wait until the defibrillator arrives before starting CPR. B. Reassess responsiveness several times to be certain. C. Begin CPR immediately after confirming no normal breathing, only gasping, and no definite pulse within 10 seconds. D. Give oxygen first, then begin compressions. Correct answer, C. Now let's see its explanation. In adult BLS, the rescuer checks for no breathing or only gasping and checks the pulse simultaneously, limiting the pulse check to 10 seconds. If no definite pulse is felt, CPR starts immediately while others bring help and equipment. Question number 33. During a hospital code on the floor, the compressor is kneeling too high over the patient's chest and struggling to achieve full depth. Which adjustment best matches 2025 AHA guidance? A. Move the compressor's position so the patient's torso is approximately at the rescuer's knee level. B. Raise the patient's head to improve compression force. C. Switch to abdominal compressions. D. Compress faster to compensate for poor mechanics. Correct answer, A. So what is its explanation? One of the 2025 adult BLS take-home messages is that chest compressions should be performed with the patient's torso at approximately the rescuer's knee level, which improves body mechanics and compression quality. Question number 34. Two providers are giving bag mask ventilation during 30-2 CPR. One provider gives large, forceful breaths because more oxygen is better. What is the best correction? A. Give larger breaths until the abdomen rises. B. Give enough tidal volume to produce visible chest rise while avoiding under and over ventilation. C. Hyperventilate between compression cycles. D. Skip breaths and use compressions only in all hospital arrests. Correct answer, B. Now let's see its explanation. The 2025 Adult BLS Guidance says ventilation should be given with enough volume to produce visible chest rise while avoiding both hypo and hyperventilation. Excessive ventilation is a classic code team performance trap. Question number 35. The defibrillator arrives, a shock is delivered, and the monitor operator says, "Hold compressions while I see what rhythm comes next." What should the team leader direct? A. Hold CPR until the rhythm clearly organizes. B. Resume CPR immediately for 2 minutes until the next prompted rhythm analysis. C. Check a pulse before restarting compressions. D. Give 2 rescue breaths, then reassess. Correct answer, B. Let's see its explanation. After a shock, the adult BLS algorithm directs the team to resume CPR immediately for 2 minutes until the next prompted rhythm analysis. Post-shock pauses are frequent in hospital era. Question number 36. During the next rhythm analysis, the AED defibrillator says, "No shock advised." A new staff member says, "Then CPR isn't helping." What is the correct next step? A. Stop CPR and wait for ALS only. B. Resume CPR immediately for 2 minutes. C. Remove the pads and monitor only. D. Give naloxone before resuming CPR in all cases. Correct answer, B. Let's see its explanation. If the rhythm is identified as non-shockable by the device, the adult BLS algorithm still calls for immediate resumption of CPR for 2 minutes until the next rhythm check. Question number 37. During a hospital code, someone suggests delaying manual compressions until a mechanical CPR device is brought from another unit. What is the best response? A. Wait for the device because mechanical CPR is now preferred. B. Begin high-quality manual CPR now. Routine use of mechanical CPR devices is not recommended. C. Use no CPR until all equipment is ready. D. Provide ventilation only until the device arrives. Correct answer, B. Now let's see its explanation. The 2025 Adult BLS Guidance states that the routine use of mechanical CPR devices is not recommended. Manual, high-quality CPR should begin immediately rather than waiting. Question number 38. A code is called on a patient found unresponsive after receiving opioids. The patient has a definite pulse but is not breathing normally. What is the best BLS team action? A. Start chest compressions because the patient is unresponsive. B. Give 1 breath every 6 seconds. Recheck the pulse every 2 minutes, and administer naloxone if opioid overdose is suspected and it is available. C. Shock immediately because opioid patients can arrest suddenly. D. Wait for ALS to manage the airway before doing anything. Correct answer, B. Let's see its explanation. In adult BLS, if the patient has a pulse but abnormal or absent breathing, rescuers provide 1 breath every 6 seconds, recheck the pulse every 2 minutes, and administer naloxone if opioid overdose is suspected and it is available. Question number 39. A healthcare worker says, "I should not start CPR until I have every piece of PPE perfectly on." The patient is in cardiac arrest. What best reflects 2025 AHA BLS guidance? A. CPR should never begin until full enhanced PPE is completed in every setting. B. It is reasonable to use PPE while performing CPR. C. PPE is forbidden during CPR because it slows compressions. D. Only non-clinical staff should begin CPR before PPE is available. Correct answer, B. Let's see its explanation. The 2025 Adult BLS take-home messages state that during adult cardiac arrest, it is reasonable for rescuers to use personal protective equipment while performing CPR. The key trap is delaying care unnecessarily instead of starting effective resuscitation as safely as possible. Question number 40. During a code on a patient with obesity, a team member says standard BLS compression technique does not apply and the team should wait for a special device. What is the best response? A. Delay CPR until bariatric equipment arrives. B. Perform adult CPR using the same techniques as for the average weight patient. C. Use half-depth compressions to reduce injury. D. Ventilate only until a larger backboard is found. Correct answer, B. So what about the explanation? The 2025 Adult BLS guidance states that CPR for adults with obesity should be provided using the same techniques as for the average weight patient. Waiting for special equipment is another avoidable code delay. Question number 41. A telemetry monitor alarms for a wide, complex tachycardia. A nurse rushes in and sees the patient sitting upright, pale, and anxious, but awake. What is the best first action at the BLS level? A. Start chest compressions because the monitor shows a dangerous rhythm. B. Shock immediately before the patient loses consciousness. C. Assess responsiveness, breathing, and whether a pulse is present. D. Disconnect the monitor because telemetry can be misleading. Correct answer, C. Let's see its explanation. BLS starts with the patient assessment, not the monitor label. If the patient is awake, CPR is not started. The responder first assesses responsiveness, breathing, and pulse. An alarming rhythm strip alone does not equal cardiac arrest. Question number 42. A post-operative patient is found collapsed on a bathroom floor between the toilet and wall. The floor is dry, the scene is safe, but the space is cramped. A staff member says CPR should wait until the patient is moved back to bed. What is the best response? A. Move the patient first, even if this delays CPR. B. Begin resuscitation where found if high-quality CPR can be delivered safely and effectively. C. Wait for the full code team before touching the patient. D. Give 2 rescue breaths only until more space is available. Correct answer, B. So what about its explanation? Adult BLS guidance supports conducting resuscitation where the patient is found as long as high-quality CPR can be delivered safely and effectively. Delaying CPR just to relocate the patient is a common trap. Question number 43. A patient in the dialysis unit becomes unresponsive. While staff are assessing, the patient briefly has a few irregular limb jerks and occasional gasps. No definite pulse is felt within 10 seconds. What should the team do? A. Wait because the movement means circulation is present. B. Place the patient in recovery position. C. Start CPR immediately. D. Give naloxone first because gasping suggests overdose. Correct answer, C. Now let's see its explanation. Brief abnormal movement does not confirm circulation, and gasping is not normal breathing. If no definite pulse is felt within 10 seconds, the patient is treated as pulseless and CPR begins immediately. Question number 44. A visitor in the cafeteria suddenly coughs after swallowing food. He is able to speak in short sentences and cough forcefully. What is the best immediate action? A. Start repeated 5 back blows and 5 abdominal thrusts. B. Encourage coughing and watch for progression to severe FBAO. C. Start CPR to prevent deterioration. D. Perform a blind finger sweep. Correct answer, B. The explanation is, if the adult can still cough forcefully or speak, severe FBAO is not yet established. The correct action is to encourage cough and continue checking for signs of severe obstruction. Question number 45. A minute later, the same visitor can no longer speak, has a weak cough, and is turning blue. What is now the correct 2025 AHA sequence? A. 5 abdominal thrusts only. B. 5 chest thrusts only. C. Repeated cycles of 5 back blows followed by 5 abdominal thrusts. D. Immediate CPR while still responsive. Correct answer, C. So let's see its explanation. For a responsive adult with severe FBAO, the 2025 adult choking algorithm recommends repeated cycles of 5 back blows followed by 5 abdominal thrusts until the object is expelled or the person becomes unresponsive. Question number 46. An outpatient collapses in a hallway outside imaging. Staff confirm unresponsiveness, no normal breathing, and no definite pulse. One rescuer starts compressions while another brings an AED. What should happen when the AED arrives? A. Continue compressions and ignore the AED until 5 cycles are complete. B. Attach the AED as soon as possible and follow its prompts. C. Check the pulse for a full 30 seconds before using the AED. D. Give 2 breaths before applying the AED. Correct answer, B. The explanation is, in adult BLS, high-quality CPR and prompt defibrillation are the key early interventions. The AED should be applied as soon as it is available, and the team should follow its shock, no shock prompts. Question number 47. A patient in cardiac arrest receives an AED shock in the ambulance bay. The rhythm on the screen now looks less chaotic. One staff member says, "Let's wait and see if the rhythm settles." What should the team do? A. Pause and observe the rhythm for 20 seconds. B. Check for pupillary response first. C. Resume CPR immediately for 2 minutes. D. Remove the pads and reassess in 1 minute. Correct answer, C. Now let's see its explanation. After a shock, the adult BLS algorithm calls for immediate resumption of CPR for 2 minutes until the device prompts the next rhythm check. Post-shock observation pauses are incorrect. Question number 48. A patient on the step-down unit is found unresponsive after receiving opioid analgesia. The patient has a definite carotid pulse but is not breathing normally. Which action is best? A. Start chest compressions. B. Give 1 breath every 6 seconds, check pulse about every 2 minutes, and give naloxone if available. C. Wait for respiratory therapy before assisting ventilation. D. Shock first because drug-related arrests are often sudden. Correct answer, B. So what about its explanation? If a pulse is present but breathing is absent or abnormal, adult BLS directs rescuers to provide 1 breath every 6 seconds, recheck pulse every 2 minutes, and administer naloxone if opioid overdose is suspected and available. Question number 49. A visibly pregnant visitor in late pregnancy develops severe choking, cannot speak, and has a weak cough. The rescuer cannot appropriately encircle the abdomen. What is the best intervention? A. Use 5 chest thrusts instead of abdominal thrusts. B. Use 5 abdominal thrusts anyway. C. Start CPR immediately while still responsive. D. Give rescue breaths only. Correct answer? A. Let's see its explanation. The adult FBAO algorithm states that for people in the late stages of pregnancy, or when the rescuer cannot encircle the abdomen, chest thrusts are used instead of abdominal thrusts. Question number 50. During a prolonged in-hospital resuscitation, the compressor says they are fine, but compression depth is visibly getting shallower. What is the best team action? A. Keep the same compressor unless compressions completely stop. B. Switch compressors about every 2 minutes to maintain high-quality compressions. C. Speed up the compression rate instead. D. Stop breaths to reduce interruptions. Correct answer? B. So let's see its explanation. The 2025 Adult BLS guidance supports switching compressors approximately every 2 minutes to maintain high-quality compressions. Fading depth is a quality problem even before complete fatigue occurs. Thanks for joining this BLS exam preparation session. Keep practicing your CPR exam skills, stay sharp with the latest AHA updates, and review each step until it becomes second nature. If you want more guideline breakdowns, exam tips, and updated AHA content, make sure you subscribe and turn on notifications. I'll see you in the next video.